Good afternoon, everyone, and thank you for joining us for today's Facebook Live during Kidney Action Week. My name is Mike Spigler, and I'm the Vice President of Patient Services and Kidney Disease Education at the American Kidney Fund. For those who are new to us, AKF is the nation's leading nonprofit working on behalf of the 37 million Americans with kidney disease. Our mission is to fight kidney disease on all fronts to help those affected to live healthier lives. You can learn more about AKF by visiting us online at kidneyfund.org. And although we can't host our traditional live in-person Kidney Action Days due to the ongoing COVID-19 pandemic, we are working all week to put the spotlight on you and your kidney health. And we're working hard to bring you a week filled with lots of fun activities and interesting information that you can use to know your kidneys and live your best, healthiest life. Everyone has questions about their kidneys and kidney disease. So today, we're talking with a leader in the field of nephrology, Dr. Silas Prescod Norman. Dr. Norman is a transplant nephrologist at the University of Michigan Health Systems in Ann Arbor, Michigan. He was born and raised in Detroit and attended the University of Michigan as an undergrad and medical school at Wayne State University School of Medicine. After completing his residency at Baylor College of Medicine in Houston, Dr. Norman returned to the University of Michigan to pursue nephrology and transplant nephrology fellowships and has been on staff there since 2002. Dr. Norman is deeply committed to health equity and works tirelessly to make more kidney transplants possible for patients who are members of racial and ethnic minorities, as well as HIV/AIDS patients. He's a member of the Board of Trustees of the American Kidney Fund, and we are very privileged to have him here with us today. Thanks for joining us today, Dr. Norman.
Thank you, Mike. It's definitely exciting and a great pleasure to be here. I think any opportunity we can take to talk about kidney disease, to talk about how we can prevent kidney disease and how we might empower the patients that we take care of is a great opportunity. So I'm happy to be included and appreciate the opportunity to talk with you today.
Great. Well, thanks again. And for all of you out there, if you're watching this live, please join our conversation. Let us know you're here in the comments section. Type in your questions located next to or below the Facebook Live video stream. We'll try to get as many questions as we can answered in the next 45 minutes to an hour or so. So let's go ahead and get started. And Dr. Norman, just nephrologist might be a big word, a new word to some patients that are just trying to get into this space. And can you tell us about the job of a nephrologist and how you became one?
Sure, absolutely. So a nephrologist is just a medical kidney doctor. I originally came to this, originally thinking I was going to do just be a general practitioner. I'm a native of Detroit, and I grew up on the west side of Detroit and observed the high rates of diabetes and high blood pressure that we had in my community. And so when I thought about becoming a doctor, my original plan was to take care of people with diabetes and high blood pressure. And then through my training, I learned about kidney disease. I learned about the impact of diabetes and high blood pressure on kidney disease, and that became my focus. In the best case, as a nephrologist, what we have the opportunity to do is educate people about the causes of kidney disease and help empower people and educate people on how they can ideally prevent developing kidney disease in the first place. And if not, how they can best manage kidney disease so that they have as few ill effects from it as possible.
Great. So you just mentioned diabetes and high blood pressure. Diabetes, the number one cause of kidney failure, high blood pressure, number two. Can you talk a little bit why is that? Why are they the two leading causes?
No, absolutely. So, as you mentioned, diabetes accounts for nearly half of all the kidney disease that we see in the United States. And high blood pressure, another 25, nearly 30% of kidney disease that we see in the United States. Both of these diseases, at the end of the day, are really diseases that damage your blood vessels. And when we talk about kidneys and we think about kidney function, everybody's kidneys have hundreds of thousands of microscopic filters that help manage waste products and manage fluid. And when you get right down to it, those filters are simply little tiny blood vessels. And so in the same way as high blood pressure and diabetes can damage blood vessels in other parts of the body, they damage the kidneys by directly damaging the filtering units of the kidney And that inability to get rid of waste products effectively is what leads to the symptoms and the problems we see with kidney disease. Yeah.
Great. Yeah, and we're going to have lots of information throughout the week for Kidney Action Week. We're going to have a day dedicated to diabetes, a day dedicated to high blood pressure, and trying to manage those two things. Many people don't know this, but as many as 96% of super early stage kidney disease patients don't know they have it. Even later stages, 90% of them don't know that they have it. I'm a caregiver for my mom, and it wasn't until I went with her to a doctor's appointment that she knew, and seeing her numbers. I mean, why do so many people have kidney disease and not know about it?
Well, so that's a great observation, and one of the things that makes preventing kidney disease one of our challenges. And so it turns out the majority of us are very fortunate that we have a lot of excess capacity in our kidney function compared to what we need at a bare minimum. As a consequence, it means that as you develop kidney disease, you have to have fairly severe or fairly advanced kidney disease before you get any symptoms, often in the range of having 20% or less of normal kidney function before you could really expect to get symptoms. As a result, it just highlights how important it is that people are screened regularly by their doctors, and as we'll talk about, live healthy lifestyles in order to prevent kidney disease. It just highlights the importance of those early checks so that we have the opportunity to catch kidney disease early before there's symptoms and really bend that curve and hopefully minimize impact on people's lives.
Great. So what are some of those healthy lifestyle things that people can do to help prevent kidney disease, or even manage kidney disease if they have early stages of it, to try to avoid kidney failure?
Absolutely. So, as you previously mentioned, diabetes and high blood pressure are the leading causes of kidney disease. They account for about 70% of all the kidney disease that we see. Both of those diseases can be, if not prevented, at least modified by healthy lifestyles. And by healthy lifestyles, we think about healthy diets as recommended. That is, moderation in our meat intake, eating vegetables regularly, healthy fruits. And then the other half of that really has to do with people's activity, living an active lifestyle, a lot of aerobic activity. Those things are known to improve blood pressure, improve diabetes control, improve body weight, and make people feel better. And those are exactly the things that can help minimize kidney disease. And I know that we have a lot of great information that you maybe talk about on the American Kidney Fund website to help guide people into these healthy lifestyles.
Yeah, I mean, at least as far as food goes on its own, we have a great resource called Kidney Kitchen. So it's kitchen.kidneyfund.org, and you can find recipes and cooking demonstrations. In fact, we have one of the contributors to that website actually posted something in the Facebook group earlier about a kidney-friendly sloppy Joe recipe. So lots of great information there. We're getting some questions in the Facebook feed regarding, you talked about healthy lifestyle. Obviously, that's important. Are there certain medicines that people should take to help manage their kidney disease, or to avoid to make sure that they're not damaging their kidneys? Lots of questions about, are there things that damage the kidneys from a medicine standpoint?
Sure. So in terms of medications, the main medicines we talk about in terms of avoiding really are what we call the non-steroidal anti-inflammatory medications. These are medications like ibuprofen, so Motrin, Advil, those kind of medications. We know that those medications have some potential to injure the kidneys, and so we ask people to minimize those as much as possible. In terms of medications that help the kidneys, there are no medications that would necessarily prevent kidney disease, but certainly in patients who have diabetes and people who have high blood pressure, we often talk about the ACE inhibitors or angiotensin receptor blockers, classes of medications which have been shown to have what we call kidney protective impact on the kidneys. And this is largely because they minimize the high blood pressure related damage that happens to those microscopic kidney filters.
Sure. That makes sense. And ACAF has lots of information on managing diabetes and high blood pressure and fact sheets. And I would encourage anyone to visit that as well. And just a reminder, if you're just joining us now, thank you for being here. being part of our Ask a Nephrologist Facebook Live with Dr. Silas Norman. Please join our conversation. Type in questions, comments into the window next to or below the Facebook Live video stream, and we'll try to answer as many of them as possible going through. So what about the tests for kidney disease? If someone is worried about having kidney disease, the risk factors for kidney disease, what are some of the tests?
Absolutely. So there's two main tests. There's a blood test and a urine test. And in the blood test, what we look for is something called creatinine. It's something that comes from our muscles. We all have it. A little bit leaks into our blood every day. And the interesting thing about creatinine is that the only way you get rid of creatinine is through the kidneys. And because of what we understand about creatinine, it allows us to back calculate your kidney function. So the blood test is one of the main ways. The second thing that happens is when your kidneys are working well, the only thing that goes into the urine are very small molecules. And when you have kidney damage, what happens is that bigger things like proteins are able to leak into the urine. And so the second test we use to look for kidney disease is actually a urine test, where we look typically for protein in the urine, excess protein in the urine, which is often a very early sign that there's kidney damage, even if your numbers look okay.
Sure.
Those are the two things that we would recommend getting done.
Great. Thank you very much. So we're getting some questions in the audience regarding fluid and water and what should a CKD patient be doing as far as water and fluid intake versus someone that has kidney failure, maybe on dialysis. What is the difference? What do they need to look out for?
Sure. So for folks who do not have kidney disease or have early stage kidney disease, staying well hydrated is very important for a number of reasons. And we recommend that people drink to thirst. And sometimes we need to give people specific targets for those folks who tend to not drink a lot. One of the challenges as people get into moderate to severe kidney disease is an inability to get rid of fluids effectively. And there, it's important that people work with their doctor to really have a more individualized target about how much fluid they should be taking in. And then certainly, perhaps most importantly for folks on dialysis, a number of people continue to make urine when they're on dialysis, but often that urine amount output will decrease over time. And so there, it's very important to work with your doctor to find out between dialysis sessions how much fluid one can safely take in without causing a problem.
One of the questions we get a lot, and I've seen actually in the Facebook group a couple times too, is just regarding, okay, I've been diagnosed. What does that mean, right? What does that mean from a life expectancy standpoint? Does this mean, I'm in the early stages of CKD, how much time do I have? That's kind of a question I get. And I know it's very individualized, right, based on what's causing the kidney disease. And but, what are some of the expectancies for someone in the early stages of CKD? What are their chances of avoiding kidney failure? We'll just start with that question.
Yeah. So as you mentioned, so that answer is going to be individualized for each person, but it's fair to say, as a general statement, for people with early stage kidney disease, one of the things that is exciting and one of the things that makes events like this important is that people can really bend that curve, and people don't have to progress to advanced kidney disease. People have a lot of opportunity, again, as we talked about, through healthy diets and lifestyle modification to really help keep their kidney function stable for years, if not decades. And so there's a lot of opportunity to have normal or near normal life expectancies if people really take advantage of early screening, knowing what their kidney function's like, and then taking these opportunities that are good for a variety of reasons to bend the curve. One of the things I think as important as kidney disease is, and as we talk about the progression of kidney disease, and people are often concerned about, what's my risk of needing dialysis? What's my risk of eventually needing a transplant? And those are certainly important things. But I think one of the things people often don't realize is that one of the most substantial consequences of having chronic kidney disease is a substantially increased risk of cardiovascular disease. That is, heart attack and stroke risk goes up dramatically. And when people think about the increased mortality or increased death risk associated with having kidney disease, a lot of that risk is really the risk of excess heart attack and stroke risk. And so when we talk about this healthy lifestyle and we talk about the activity, it's as much about minimizing the chances that people have heart attacks or strokes as it is minimizing the chances that people develop advanced chronic kidney disease.
Okay. We're getting some questions from patients in kind of the later stages of CKD, stage 4, maybe even early stage 5, that are now faced with thinking about what their options are from a dialysis standpoint, from a transplant standpoint. Can you just talk a little bit about the two different main types of dialysis and transplant and kind of pros and cons of each of those?
Absolutely. So when we talk about dialysis and we talk about transplant, we broadly talk about those as kidney replacement therapies. They're not cures. They're really different ways of managing inadequate kidney function. So in order of the most common things, so many people commonly think of dialysis. There are two main forms of dialysis. There's hemodialysis, where we have some connection to your bloodstream. Blood is taken out of the body. It goes into a dialysis machine that helps clean the blood, helps manage fluid, and then the cleaned blood is returned back to the person. People most commonly will go to dialysis usually 3 times per week. And increasingly, people are able to do dialysis at home and do what we call home hemodialysis, where people are able to dialyze 5 or 6 days a week. And we know that as people dialyze more, as you get more effective kidney function, people do better. The other main form of dialysis is something called peritoneal dialysis. Each of us in our abdomen have a very thin membrane that holds our small and large intestines, called the peritoneal membrane. And you can actually use that membrane to do dialysis. And so people would have a catheter that goes into their abdomen, and you would flush clean fluid into that, into your abdomen several times a day, and flush back out fluid that contains a lot of the waste products you need to get rid of. There are pluses and minuses of each form of dialysis. One of the main benefits of peritoneal dialysis is that it helps facilitate an active lifestyle, which is that you can often do the dialysis around your work or life schedule, as opposed to hemodialysis, where it really tends to occur at fixed times during the week, and so you have to kind of adjust your life around dialysis. The home hemodialysis has similar advantages in terms of lifestyle. The other benefit of home hemodialysis, because people have more dialysis, is that medically people do better.
I would imagine both being at home right now too has got to be a benefit too, with the pandemic going on as well.
Absolutely. One of the challenges for our patients who were on dialysis during the COVID epidemic was that they still needed to go to dialysis 3 times a week. The ability to minimize exposure was limited. Now, although the dialysis forms are the most common types of kidney replacement we see, in general, for most people, what we think is the optimal type of kidney replacement, that is, if we couldn't prevent your kidney disease and we couldn't slow the progression, if you need some type of kidney replacement therapy, then we think kidney transplant is the best way to go. And we think kidney transplants are the best form of kidney replacement therapy because, in general, people live longer and they feel better.
That makes sense.
And then I think what's important as people think about timing is we'll often talk to people about their kidney function in terms of percents of kidney function because it's easy to understand. When people start dialysis, they often have somewhere around 10 to 15% of normal kidney function. Again, highlighting how advanced that function needs to be. What's important as we think about transplant, as we think about what we think is the optimal way to go, is that when we place people on the transplant waiting list, you can be on the waiting list when your kidney function is 20% of normal or less. That's important because that means that to properly get people on a transplant waiting list, we really need to be evaluating people for transplant when their kidney function is in the 20 to 25% of normal range, so that we can get people worked up, evaluated, have all their testing done, so that when they get to 20, we can get them on the transplant waiting list, with a goal being that from the time they're 20 to the time they might be 10 or 15 and need dialysis, ideally we can get them a transplant in that window, and maybe they never need dialysis at all.
Great. Thank you, Dr. Norman. If you're just joining us again, we are live. So thank you for being here, being part of this. If you have any questions, we are taking them, put them in the Facebook Live video stream, and we will get them answered as we go along. One of the questions that we got, Dr. Norman, was regarding kidney disease and whether or not it is genetic or not. I know we see higher rates of African Americans and Hispanics getting kidney failure once they have kidney disease, but is there a genetic component to that? If you have kidney disease, are you at risk for your kids to have it? Brothers and sisters?
Sure. So, no, very important question. And so, um, there are certainly some diseases that are clearly specifically genetic. Things like polycystic kidney disease that are clearly inherited diseases. Um, but for most diseases, particularly as we think about diabetes and high blood pressure, those don't appear to be, in a strict sense, inherited diseases. What we do talk about often is that these are familial. And what we mean by that is that there's probably a combination of underlying genetic factors plus lifestyle plus environment that lead people to have higher risk of developing these diseases. Um, Even within diabetes and high blood pressure, we do see some genetic contribution. Some people may be familiar. There's something called ApoL1, which you may have heard a lot about recently. Uh, this ApoL1 gene, turns out that people who have two copies of a high risk of this gene do seem to be substantially more likely to develop high blood pressure and kidney disease. But again, even as we talk about ApoL1, it's not as if everybody who has two high risk copies of ApoL1 develops high blood pressure or kidney disease. And so I think it's very important that even in these what we call familial diseases, these ones, and with familial we mean that if both your parents have diabetes, it's more likely that you're going to have diabetes, but not absolute. And a lot of that, as you can appreciate, is going to be some genetics, but it's also going to be that you and your parents probably lived in the same places, you and your parents probably had the same diets, activity may be similar, so there's a lot of overlap. And I think what's most important is that even in these familial diseases, we have a lot of opportunity, again, going back to these same things, to lifestyle modification, increasing our physical activity, eating healthy diets, to, again, bend that curve and minimize our chances of developing these diseases. Um, Even in the diseases that are inherited, like polycystic kidney disease, the lifestyle modification is still tremendously important. Eating a healthy diet, being very active, even in these genetic diseases, can help slow down the progression or advancement of chronic kidney disease.
So a little while ago, you mentioned, about the percentage of kidney function left when someone may want to get on the transplant list. Just kind of along those same lines, like when should someone be seeing a kidney specialist in general? Like what percentage kidney failure or kidney function left, or what stage of CKD? And similarly, along the same lines, what about dialysis? Like when should someone really be thinking about starting dialysis?
Sure. With our ongoing caveat that you have to individualize a little bit, but in general, we recognize a couple of things. Most of the care that people get for their chronic kidney disease is actually going to be delivered by people's primary care physicians, not kidney specialists. Um, and that's just because there are so many people with kidney disease that to make things manageable, we really rely heavily on our primary care partners who are very good and know the recommendations for helping people minimize their progression. Um, we often talk about stages of kidney disease, and so often we'll talk about the idea that when people are somewhere between 30 and 40% of normal kidney function, those are folks who probably need to be seeing a kidney specialist so we can give them additional help and direction. Um, it's important to, as we think about, again, transplant as an optimal strategy. One of the things where people often don't come to the transplant specialist in time is because they weren't seeing a kidney doctor uh, uh, early enough. And so that, somewhere between 30 and 40% of normal kidney function, again, varies by the person in their particular circumstances. People should probably be engaged with a kidney doctor. Depending on their specifics, it may be that you see that kidney doctor once and you get some recommendations back to the primary care physician, and you don't need to see them regularly. Um, in terms of when to see a kidney doctor and thinking about dialysis, we know one of the biggest challenges in helping people is about 2/3 of patients have only see a kidney doctor within about 12 months of starting dialysis. That is, that by the time they see the kidney doctor for the first time, they have fairly advanced kidney disease. That's important because even the best kidney doctor can't change the trajectory dramatically if you come to see somebody just a few months before you really need dialysis. And so, again, goes back to the point you made, Mike, of that early testing to find out if you have kidney disease, regular engagement with primary care physicians so that that disease can be tracked, to allow for good, timely referral to kidney specialists so we can do the best we can for patients to minimize the impact.
It's such an important point you made about, so many patients not getting to a nephrologist in time. And, we see so many patients that have just what we call crash into dialysis, that have just not feeling well, go to the emergency room, and suddenly they're told they need to start dialysis immediately. And that's one of the great things about the Kidney Fund, is that we're there to help them, financially through some of those crises that happened when that occurs. Regarding the transplant list, any advice on getting on the transplant list is the question. And also, does blood type affect someone's ability to get a transplant?
Sure. So I'd say probably three things about that. I think as a general statement, everybody with advanced chronic kidney disease should be evaluated for transplant. I think, with rare exception, we shouldn't close the door to transplant before you've been seen by a transplant specialist and let us look at you. We want people to do as well as possible. So what does that mean? Whenever possible, we want people to get their transplant without ever having to go through dialysis. And that means we have to do things a little earlier than we would for planning. So with the idea that we can place people on the transplant waiting list when their kidney function is 20% of normal or less, that really means that the ideal time for us to see people is between, when their kidney function is 20 to 25% of normal. For some people who are progressing rapidly, it may even be between 25 and 30% of normal, so that we have enough time to get people evaluated. There's also two ways to transplant people. They can get a transplant from the deceased donor waiting list, or the waiting list that people think about. In many places like Michigan, that waiting list is about 5.5 years long. And so again, it's important that we see people in a timely manner to do the best we can for people. The other way people can get a transplant, though, is from a living donor. And this can be somebody who's related or unrelated. It simply needs to be somebody who's healthy and interested. So the other benefit of seeing people in that 20 to 25 or 20 to 30% kidney function range is it also gives us an opportunity to talk with you about living kidney donation, about how to ask for potential kidney donors, about who those folks might be, and also get those folks evaluated to really put people in the best chance to have the best options for getting a transplant. And then finally, blood type. So that's important. So people certainly have to have a compatible blood type to donate. So again, one of the benefits of looking at potential living donor candidates early is to see who's blood type compatible. The other important thing is that across the country, in majority of certainly of the larger transplant centers, all participate in what's called kidney paired donation. Mm. And this, people have probably seen, a few television programs or read about. And this is where we talk about swapping donors, with the idea that my wife may not be compatible with me, but she may be compatible with somebody else. And so my wife would donate to somebody who needs a kidney. Their potential donor would donate to me. 2 transplants get done, 2 lives are enhanced. And so people shouldn't worry too much about blood type. In thinking about transplant, I think the most important things to do are to let us see you in a timely manner, look for potential living kidney donors, let us help you with how to ask and how to follow through and educate the donors so that we can get people transplanted in a timely manner.
Thank you, Silas. And I know those pair donations, I think they've gone up as many as like 12 different kind of chains that have happened, right? So It really is amazing. And for those of you who are interested, on our website, we actually have some archived webinars. We have a monthly webinar series. We have one on getting on the transplant list, and we also have one about paying for a transplant. So both of those are really great information pieces that we have. So some questions about diet. What are the different diet considerations for someone in like an earlier stage of kidney disease versus someone that's in late stage or kidney failure?
Sure. So for the vast majority of people with mild to moderate kidney disease, the recommendations for diet, are going to be the same recommendations we would have for the general community. That is, a plate, as my dietitian likes to say, a plate that's, half vegetables, grains, and moderate on the protein, on the animal-based proteins. And that would be true for the majority of folks with or without kidney disease. And then a good amount of water intake, as we talked about earlier. As people get into advanced kidney disease, there are some changes based on the fact that there are some substances that your kidneys can't get rid of effectively. And so, in working with your doctors, in working with the dietitian at your physician's offices, there will be the need to restrict things like potassium intake and phosphorus intake as the kidney function declines. It's important, actually, that people work with their physicians and their dietitians, and look at resources like the Kidney Kitchen on the American Kidney Fund site, because what's very important is we still want people to be well nourished. We don't want to compromise people's nutrition, and it's understandably difficult for people often to try to figure out how to restrict their phosphorus or restrict their potassium without restricting calories or having a healthy diet. But it can be done. It can be done affordably. And so, again, has to be individualized, but there's a lot of resources out there to help people figure out how to, as we say, live their best lives, even with kidney disease.
Yeah, and many people don't know this, but for those with chronic kidney disease and obviously someone with kidney failure, you have access, most people do through their insurance, to see a dietitian and get some free sessions on how to kind of adapt to this. And of course, as you mentioned, there's plenty of information on the Kidney Fund's website as well, on Kidney Kitchen. Again, if you're just joining us, we are live. Thank you for being here. Our Facebook Live with Dr. Silas Norman. Please make sure to type your questions and comments into the window. They're being fed over to me, and I can see them live, and we are answering as many of them as we can over the next 20 or 30 minutes or so. All right, one question. Let's see. What question should patients with early stages ask their doctor?
Interesting. So I think the question is, what can I do to manage my kidney disease so it doesn't progress any further? And the cornerstones of that, depending on what underlying diseases people have, are going to almost certainly be great blood pressure management, very good diabetes management, and then the usual, and I know we keep harping on these things, the usual lifestyle modifications. And so the healthy diet, the being really active, those things really do, the activity and eating healthy don't sound terribly exciting, but those things do more than anything to help people be healthy. And I think it's very important to have a good line of communication with your healthcare provider, and to be really deliberate and be an advocate for your health, to say, as the question stated, what is it I need to do to be as healthy as possible? So that you can set targets with your healthcare provider and make sure that you're on track, and that you're doing everything you can to be healthy. And then one of the things we're thinking about, many of these changes, right? I mean, most of us have families, and so a lot of these changes happen within families. And so, when we used to talk to people about smoking cessation, it was clear that it was very hard for someone to stop smoking if everyone in the house was still smoking. And so a lot of these changes are really family changes. And so, when we talk about a healthy diet, we're not talking about everyone eating what they used to eat and you having sort of a separate plate. It's really most effective, we know, if everybody in the house, helps transition to a healthy lifestyle and a healthy diet. There's a lot of delicious, great, affordable food that people can eat. And so going to a healthy diet doesn't mean a diet that doesn't taste good. It just means really making that transition. A lot of the physical activity, right? It's going to be more fun, and we know it's more sustainable if everyone else in the family, participates and kicks in, and then the whole family gets healthy. And so, but setting those good targets and good communication with your physician or other provider, I think, is critically important.
That's such a great point. Actually, one of our partners, Dr. Blake Schusterman, the cooking doc, I was just on a call with him earlier today, and he was talking about kind of reframing things, right? So don't take this as an opportunity about what I can have. Let's talk about different things that I can have that I haven't tried before, and how to make them and share them with your family, and look at it as an opportunity and reframe this, what I can't have with now what I can have that's different. Just, you may be eating the same, meals for the 40, 50 years, right? This is a chance to kind of get outside of your box a little bit and just reframe it instead of like what I can have.
Absolutely.
Question is, any new advances in kidney disease research and or treatment?
So there are, in a great way, continual advances across the board. And so, with the caveat that those lifestyle things remain critical, depending on which disease we're talking about, there's some specific advances for a number of diseases. Transplant medicine is always evolving in terms of techniques and medications, and we have, already had good outcomes, and we continue to have better and better outcomes for folks. And I think there's always new things on the horizon. People are always interested in things like, potential artificial kidneys, which are getting closer and closer to reality. We have some colleagues who've been working on those things for some time now. So we may have more to offer people over time. Having said that, as important as advances in the management of kidney disease is, the best thing we can do is not develop kidney disease in the first place. And so, we can't stress too much the importance of prevention. And, having a good body weight, healthy lifestyle, not smoking, as we mentioned, eating a good diet. These things are good for just about any disease we're talking about, and certainly good for diabetes, high blood pressure, chronic kidney disease, even as we have some really very fascinating advances in the field.
Great. Thank you. And again, if you're just joining us now, please feel free to put questions. We are live, and you can put it down in the Facebook live stream comments. We are still taking your questions for the next about 10 minutes or so, I believe. So let's see. Next question regarding kidney stones. Can kidney stones cause kidney disease, or I guess, chronic kidney disease?
Sure. The answer is yes. And they can do that through a couple of mechanisms. The stones themselves can be physically damaging as they pass through the kidneys and out through the bladder. Kidney stones often, the drainage tube from the kidney to the bladder, sometimes stones can get stuck because they're that big. That's often when people realize they have kidney stones, because they have acute pelvic pain.
Mm-hmm.
That blockage of urine flow can cause damage to the kidneys, what we call obstruction. In addition, that blockage can also set people up for infections, and having recurrent infections can cause infection-related damage to the kidneys. And so kidney stones, besides potentially being uncomfortable, can also directly cause kidney damage.
So I've seen in our Facebook group, which has been great, and thank you all for joining it and being a part of it. I think we've had over 1,800 people the last I saw in the Kidney Week group, which is fabulous, and lots of support there between each other. But taking care of a loved one with kidney disease is very difficult and challenging at times, rewarding in some ways too. Any advice for caregivers who are taking care of someone with kidney disease?
Sure, a couple caveats. So I think it goes without saying that caregivers for folks with chronic diseases do just a Herculean effort. It's a 24/7 job often, and we know that these diseases end up being a team effort. That we know that our patients do best when they have a strong team of people behind them, and so the caregivers are really essential. I think a couple things. One is that because this is a long-term commitment for the caregivers, it's important that the caregivers remember to take care of themselves, and get rest when they can, and stay energized, and do what they need to do so that they're available, and that we don't compromise the caregiver's health. There's actually a number of studies that actually demonstrate, particularly for women, tend to be great caregivers and neglect their own health. And so one thing is just think about the caregiver's health. The other thing is to remind people that they're not in it alone. So among other things, the American Kidney Fund has a lot of great resources for caregivers, and there are support groups and so forth. So people don't have to think that they're in this alone. And then I think the third thing I just mentioned is that as people educate themselves on disease, it's important for people to know what are the options, what are the optimal therapies, what are the best way to help. their loved one get through this. And even little things like, how do we move this person to transplant? One of the best benefits of transplant, outside of benefiting the patient, actually, is that it benefits the caregiver. That person being healthier and being off dialysis allows the caregiver to get some time, and allows the caregiver, to go back to work. So we want to fully support our caregivers. We know they do a tremendous job. I'd encourage people to look at some of the information that the AKF has to offer in terms of helping support the work they do.
Thanks, Silas. And yes, we have some webinars and other information about caregivers on our site for just that reason. So one more question before we start to wrap up, maybe two more, we'll see. This one's a little bit of a complex one, but I think it's kind of goes along with lots of the questions we're getting. Is, we've talked about like early stage of CKD, we've talked about advanced CKD, we've talked a little bit about the percentages and when someone needs to start dialysis or think about a transplant, but can you just walk us through in very kind of general terms the different stages of kidney disease and what's a normal GFR number?
Sure. So when we talk about kidney function, what we're really talking about is your kidney's ability to clear waste products. And so it turns out that normal kidney function is right around 100 milliliters per minute of waste clearance. And so that's why we often talk about percentages, because people are just more familiar with percentages. The GFR that Mike mentioned is the glomerular filtration rate. The glomerulus are those microscopic filters that we talked about at the start of your kidneys. And so the glomerular filtration rate, or GFR, is essentially your kidney function. A normal number for that kidney function is a number 90 or above. And so that's normal. And depending on what people have, that would be stage 0 to 1 stages of kidney disease. And we count stages of kidney disease as stages 1 through 5 with increasing severity of kidney disease. And so when people start dialysis, they're at stage 5 of kidney disease. In each of these stages, there are different things medically we would ask people to do. So as we were talking earlier, in stages 1, 2, and 3, those are in general those stages where sort of the general recommendations for healthy diet and lifestyle, just like the general population, would be intact. It's usually around stage 3 kidney disease, depending on the person. Stage 3, where people might want to see a kidney doctor, depending on their particular circumstance. Certainly in stage 4, people should have a kidney doctor. And it's in stage 4 where a lot happens, because it's in stage 4 where we really need to be thinking about not just seeing a kidney doctor, but seeing that transplant center, that transplant kidney doctor, so we can do things well. And in late stage 4, kidney function, in early stage 5 is certainly where people should be having their planning for dialysis. And often people will find that they need to plan for dialysis at the same time while they're planning for transplant, on parallel tracks, so that things get done in an optimal manner. And certainly our goal is for people to ideally be diagnosed in stage 1 or 2 of chronic kidney disease, and for us to then make the changes we can to keep them in that stage and have them not progress.
Okay. One last question before I give you kind of a chance to wrap up with some closing remarks. And regarding what's everywhere right now with COVID-19, what are some any precautions or things that patients with chronic kidney disease need to know about? Or even those with diabetes and high blood pressure, they'd be at risk for kidney disease during a pandemic like this?
Absolutely. So the two important things would be, one, for some of our folks who have chronic kidney disease or other chronic diseases, may be more at risk for some of the negative outcomes or the severe impacts of COVID-19. So one is just for people to recognize they may be at higher risk. The second thing, which people may not be aware of, is COVID-19 very commonly causes kidney injury. And so it's very important for those of us who already have kidney disease to be particularly cautious and particularly diligent, because having chronic kidney disease and then getting COVID-19 superimposed on that may cause substantial kidney damage. And those are going to be folks who are at higher risk of having more negative kidney related outcomes secondary to COVID.
And we at the American Kidney Fund, we responded to the crisis early on we launched a coronavirus emergency fund for low-income dialysis and transplant patients. We've actually given out just over $3 million in that program, and have lots of information on our website, resources, links to other parts on our website. If you go to our website, you can learn all about COVID, and we've got webinars on it. Lots of great information there. Before I wrap up, I want to thank some of our sponsors that participated, that helped us pull this off. First is our presenting national sponsor, U.S. Renal Care. We want to thank them very much for making not only this session happen, but our entire Kidney Action Week, and as well as our supporting sponsors, Otsuka America Pharmaceutical and Satellite Healthcare. Again, we cannot do programs like this without your help, without the help of our supporters, and we're very, very grateful. So, Silas, as we wrap up, I just wanted to thank you again for the time that you've spent with us. But what's the main takeaway you want kidney patients to know about preventing kidney disease?
Absolutely. No, thank you. So I appreciate the opportunity to join. I think if I could tell people one thing, is that kidney disease is preventable, and it's manageable. And if people left with only remembering one thing, it would be that healthy lifestyle, diet, healthy eating, and physical activity. Remember, one thing will do more than anything to help bend this curve. Remember that you can be your best advocate. And then remember that there's great resources, and I very much appreciate, Mike, the American Kidney Fund putting this on, and I appreciate the education you guys do through prevention all the way through the support you offer our dialysis patients. But for everybody who joined us today, really take advantage of the AKF resources to educate yourself and make yourself the best advocate for your health.
Thank you so much, Silas. Again, thank you for spending this time with us this afternoon. We have great stuff going on all week. Cooking demonstrations, fitness demonstrations. There'll be another live event on Friday to learn more about what AKF does. But we'll be taking your questions and participate in the Facebook Live group, the Facebook group all week. We can't wait to bring more of this to you. So, Silas, again, thank you so much for participating. We're going to bring you back for more of these chats in the future, I anticipate. So again, if you aren't already, please follow the American Kidney Fund on Facebook. Send us your email through kidneyfund.org, and you'll be the first to know about other events like this. Thanks, everyone, for joining us, and have a great day.
Take care, everybody.